Hello and namaste everyone. Myself Sampada dhimal, BSc Nursing fourth student, and I am currently studying at BPKIHS, Institute of Health Sciences, Dharan. Today I am very excited to be here to speak with Professor Dr. Kimberly mciltrok from Johns Hopkins University. Professor Dr. Kim brings extensive experience in pediatrics and has dedicated herself to advancing nursing education and mentoring future healthcare professionals. Welcome and namaste, Dr. Kim. Can you please introduce yourself?
Namaste. Thank you for having me today. I'm Dr. Kimberly mciltrok, and I am a pediatric nurse practitioner, and I'm also a wound ostomy continence nurse, and I am a associate professor at Johns Hopkins University.
Wow, that's really nice. How are you feeling about your experience at our university, BPKIHS?
Well, we've been having a wonderful, today was our third day. We've been having a wonderful time. It has been such a great learning opportunity for us to not only get to know a little bit about your country and your community, and also to spend time with all of you nursing students and learning about your College of Nursing and your campus here.
So, yeah, we are very glad that we met you. We are having a very good time with you as well. So, could you please tell us your journey to nursing and what motivated you to pursue a career like nursing?
Yes. Well, after high school, I had applied to go to college. And so I applied to nursing school. And I always, I think growing up, was interested in nursing and healthcare and, took like CPR classes and first aid classes and did jobs like that. And then we have something called ROTC, and that helped me go to college um, as far as like financial. So I attended Widener University in Pennsylvania in the United States, and that was a 4-year bachelor's degree in nursing. And then after that, I had to serve 4 years in the military. So I was an Army nurse. And I ended up working in pediatrics. So I really enjoyed pediatrics. I didn't know that was exactly what I was going to do, but the Army put me in that area and I loved it. So then when I was released from the military, I decided to go back to school to be a pediatric nurse practitioner. So that's an advanced practice role in our country. And so I went to University of Maryland, and it's a 2-year degree to get your master's, and then you take a national certification exam for certified pediatric nurse practitioner. And I did that. And then soon after that, I started working at Johns Hopkins Hospital, and I worked there for almost 30 years in pediatric surgery as a nurse practitioner. So I would go to clinic to see patients, to prepare them for the operating room. Then I would see them, the surgeons would do the surgery, and then after surgery, I would follow the patients post-operatively to take care of them. And then 9 years ago, I moved over full time to Johns Hopkins University School of Nursing and have been serving as a professor there. So that's kind of a condensed version of my journey.
So, I would like to ask you that which either clinical or in the side of education, which one do you prefer doing?
So I have the privilege of doing a little bit of both. So I guess I forgot to mention in there that while I was working at the hospital, I went back to school to get my doctorate, and I have a Doctor of Nursing Practice degree called the DNP, which is different from PhD. So I don't think that you have that degree here in this
We don't have
country.
that degree here.
So the DNP is more of a clinical degree, And although I'm a professor at Johns Hopkins, I'm also in practice 1 day a week where I have a clinic and I see patients. So I think that I have the best of both worlds because not only do I get to be in practice to help me stay up to date, like what is going on, in healthcare and in practice, but then I also get to teach and be with students.
Wow, it's really nice. So, what do you think? What are the some emerging career opportunities in nursing that the students should be aware of?
Um, well, I feel like it's limitless. There are so many different things that you can do in nursing, um, as far as there are multiple types of work in the hospital, and then, of course, a lot of jobs outside of the hospital. There's teaching. Um, we have nurses who work in schools. Do you have school nurses?
Yeah, yeah.
Yes.
There is a provision of school nurses in our country too.
Oh, wonderful. So you can be a school nurse. Um, we actually have nurses who may work for insurance companies um, because of the way that our healthcare is set up. They may work for that. We have nurses who go into like informatics, which is like computers and helping in that area, and home care. Like we were out in the community today, and we do, community work, home care work, which is actually starting to grow again, where we're doing a lot of work in the community.
So, I have some curiosity about travel nurses. What do you have anything about to say that?
Oh, so that's definitely like a job that you can get. So you would go with a travel nursing company, and so if maybe a hospital, for example, has a shortage in nurses, like on a certain type of unit, the hospital may contract with the travel nurse company, and then that nurse could go there. So let's just say you wanted to work in Los Angeles, California. You could sign up with the travel nursing company, and if there have any openings, then you would move to Los Angeles, and they would put you in the hospital there. I think to do that job, you have to be really flexible, right? Because you're going into a hospital that you may not know. You may not know that institution's culture. So I think it takes a really extra flexible, organized nurse who doesn't mind change.
That's nice. Okay. What skills do you believe are essential in the nursing profession?
Um, well, I'm going to add a little more to what I had just said. I think now we really have to really work on being, like I said, organized, flexible. You have to stay up to date with all of the changes, certainly with technology, right? Just really understanding technology and how it can be beneficial for you and at work. Um, so I think, I mean, that's just a start, right? And
So, what do you say about time management skills?
definitely need time management and organization skills. Um, I think that becomes easier um, the longer that you are a nurse. I think when you're a new nurse, that can be challenging, right? Because everything is brand new. So I think those kinds of things get easier, but certainly it's always important.
That's right. Okay. In your journey, what do you find most rewarding about working in the field of nursing?
I think in my journey, obviously I've been in pediatrics. I have really enjoyed the families, like the entire family, not just the child that I'm taking care of. The kids are so amazing, and I find that children are very resilient. I think it sometimes is more challenging to work with the families because they're so stressed because their child, their baby is ill. Um, but I think it can be just really rewarding getting to know like that entire family unit and just spending time with them and learning from them. So so I actually have another thing, which is one of the reasons why I'm here. So not only working with the families that I get to work with and have the privilege of being with, but also like doing things like this, like coming to another country and really getting to, I know it's a short time period, but just getting to meet all of you and to learn a little bit about your healthcare system and, how you operate. And, I've just learned so much the last couple days just about your school system and everything that you're learning, and it's so amazing. And just getting to meet some people in your community and learn about another community in this world when most of us want the same goals.
Yeah, sure. So, as you have been here for a week, so did you find any difference in the healthcare system in your country and in Nepal or in our university?
Yes. So we have spent the last couple days in the community, and that's been really nice. At our university, we're really looking at the community aspects and, going into the community. And I really like how you have like your local community workers, and yet you're going out and seeing them and just learning about like that referral process. So we have things like that in the United States as well, and really trying to work on, improving those areas. I think, the biggest thing, obviously the biggest differences are, you know, payment systems, all of that. So that's probably a whole discussion in itself. But just really, you know, having discussions with your professors and the students. We both have skills labs, and we're doing skills, and we're working on competency-based education and making sure that everybody has those skills and looking at the evidence that's out there. We had discussions on that, which was great. And just trying to, look at the research, look at the evidence so that we can all provide good health care. So, we have the same goals and we're working towards that.
Yeah, we are all working for the people and for the improvement of the health.
Yes, absolutely.
Okay, so what are some of the biggest challenges you believe that nurses faces today?
Well, I think we maybe talked a little bit about this, but just really thinking about the nursing shortage. Like we have shortages in certain areas of nursing and in a lot of our states in our country, and it sounds like you maybe have that as well. Some nursing shortage, or maybe people go to school and then move to another area, and so it can so different shortages. So I think that's really a challenge, like what we can do to entice people to go into nursing and encourage them to go into nursing so that we could fill those gaps. I also really think, like I mentioned before, that we need to keep up on technology. So, for instance, we've been having a lot of discussion about AI, like artificial intelligence, and like how is that going to impact healthcare? And I mean, how can we utilize it to get maybe answers quicker or to run data and help us, look at these data patterns and how we can help improve like larger populations as a whole. So I think those can be challenging, but I think it can be really exciting to try to help us improve the healthcare system with some of those things.
So can you share a specific experience that had a significant impact on your career as a nurse?
A specific experience. Well, I think I would say like one of the hardest things that was the first time that I had like a patient die. That's very, very difficult. And especially like if haven't experienced anybody dying before, and then you're right there in this, intimate environment, like with this family. So I think that just like made a really big impact in trying to figure out like, how, how can I help make things better, like for the families, and just trying to understand that. And then also, just looking at, different cultures and religions and how that looks different for each community, and trying to understand that and how to change my practice so that I can be most beneficial when people are in those types of environments. So in pediatric surgery, like we have um, a lot of trauma. So unfortunately, some of the children die, and so and especially if it's a trauma, it's not expected. It can come very sudden, like for instance, a motor vehicle accident. And so just really trying to figure out like how to interface with the family and how I practice.
Oh, that's really hard.
Hmm.
So, in all this journey, does in any point of life, do you ever feel like quitting nursing, or you felt like going back, or anything like that?
Um, no, I don't think so. I mean, certainly there are hard moments, but I think that we all need to support each other. It's been so nice for me to see your class. I was commenting that you all seem so close,
Yeah, we
and
are.
you all care about each other so much. And even when you graduate here shortly, congratulations, you're getting ready to
Thank you.
graduate. Um, it's important for you to maintain those contacts and those friendships and have people that you are close with that you can discuss. And it's always helpful if it's another nurse. Of course, our families and friends can be
Yeah.
supportive, but then also other nurses like understand like what we're experiencing. So I think it's very important to maintain like those friendships and people that you can confide in so that you can help deal with the stress of the job, because it is a very stressful
Yes,
job.
it is. So, yeah. So, what recommendations do you have for nursing students seeking to advance their education?
Since you are getting ready to
Yeah,
graduate,
graduate.
I think it's important um, to find a good job where you can get a lot of experience and just spend some time at that job, for a year or two, and just really get comfortable. I mean, you mentioned time management, and I think
Mhm.
that first year, just like understanding the different disease
Yeah,
processes and using good time management and just all of your skills, getting really comfortable with that. And that will serve you well. I know sometimes people might say like, "Oh, I really wanted to work in this certain department. That's my dream
mm,
job." But I got placed or got posted over into this other
okay.
area. I think no matter where you are, you can learn,
Yeah,
right?
sure.
So just try to take in as much as you can, learn as much as you can. Um, I always say that I had a lot of experiences because I would always raise my hand and like, oh, does anybody want to do this? Yes. And so I felt like I got to do a lot of things, or then I was sent to get maybe additional certifications because I was willing to try those things and try to learn from everything. And then, um, and you'll look back later, maybe you'll see a patient and you'll be like, oh, I remember I saw this when I was in
Yeah.
this other job. So those skills will never serve you wrong. So.
Okay, we will definitely take this. So, how crucial it is for nurses to work alongside other healthcare professionals? Could you share an example from your own experience of how collaboration has made a difference?
Oh, yes. So I think it is absolutely crucial. So interprofessional education, that we work alongside the other healthcare providers. I mean, we have, of course, nurses, we have advanced practice providers, our physicians. I saw your school of dentistry here, um, pharmacy, nutrition. Well, we should all be working together. The last couple days, multiple um, positions in the community, right? The healthcare, local people who then, right, who then talk to the next level and on and on. So I think it's really important for all of us to work together, because that is how we can give the best, most comprehensive care. I think it also provides checks and balances, like, I could maybe suggest something, but then the pharmacist may say, oh, well, this medication may work better. And so I think all of us, like, learning from each other and helping each other can really make a difference. So I absolutely think it's crucial. So I have a quick question for you. Does your at the School of Nursing, do you do any activities or events where you work with the other professions?
Actually, we do not work with other professions at our college, but since we are connected with the students of dentistry and students of medicine in our hostel and in our college, so we collaborate with them, and we do the health camps and all by collaborating with the doctors of different departments. So we do that.
Nice. You also asked me about, like, in my practice. So currently, I am working in a clinic where I see children who have severe neurobehavioral issues, maybe severe autism, things like that. And they have, like, gastrointestinal continence issues. So in my clinic, I have a multidisciplinary clinic. So with me, I have a amazing behavioral therapist who is with me in the room as I examine the child with their family. And then we also have, we say OT, occupational therapist. And she also helps, she'll assess the children and then give them tips as well. So maybe just a simple example might be, maybe I decide to prescribe a medication to the child, and the behavioral therapist will work with this child to make sure that they take the medicine, and then maybe, as in behavior-wise, they take the medicine, and then maybe the occupational therapist may work with the child because maybe they can't, like, hold the cup to drink the water to take the medicine, or things like that. And so we just all work together as a team to help.
That's a very great example of collaboration, right? So,
Yes.
Okay. In terms of continuing education, what kinds of professional development should nurses focus on to stay competitive?
To stay competitive. So I think that may look different, I think, for everybody, depending in, like, what area that you want to go into. But again, initially, I think it's just getting that job experience, and then figuring out, like, what area you want to work. So we have certain, like, certificates or certifications that you can do. For instance, if you work in labor and delivery, or you work in pediatrics, or maybe the intensive care unit. So there are specific things that you could do in those areas to get certified to help you learn more about that area.
It's also essential to stay updated with the technologies too.
Oh yes, absolutely. Staying up to date with technology. Yes.
Sure. Okay. What words of encouragement would you offer to nursing students who are feeling unmotivated and regretful to the decision?
So if they're unmotivated, so I think that goes back to trying to determine, like, well, why did you go into nursing?
Yeah.
And then to really look at yourself and make sure that you are doing okay, like mentally and healthy, because it can be a stressful job. So kind of like we talked about before, you know, maybe talking to your friends, maybe talking to other to your healthcare provider to make sure that you know that you're doing okay emotionally and physically, mentally. So it is a hard job, right?
Yes.
So, you know, when you try to encourage others, like there are going to be days that aren't so great.
Yeah.
And then there are going to be fun days and amazing days. But I think just taking that into stride and realizing that it is stressful and using all of your resources can be helpful. And then also, if somebody's been a nurse for a while and they're just maybe unmotivated in that certain area, again, there's so many different areas where you could work, and maybe it's that you need to try a different area. So, you know, trying to work in a different area. Maybe, you know, maybe for some person, they might want something that's faster paced. Maybe somebody else needs it slower. And so I think just really trying to find your fit. So even if you don't like that job, it doesn't necessarily mean that you shouldn't be a nurse. It just means that you need to find a job that fits you better.
So you need to think about what fits you and what you like the most.
I think so.
Okay. So now talking about how important is innovation, technology, and research in shaping the future of nurses.
So I think that that is very crucial, more now than ever. I think we have to be innovative and figure out what we can do to make healthcare more efficient. You know, just to maybe make things easier for the patient. There could be innovative products, um, you know, ways that maybe nurses could also be more efficient to work with their patients. And then again, there's so many tools and technology right now that I feel like moving forward, like every 6 months, it's just going to look totally different. Again, back to AI and all these other different technologies that are coming forward that we probably don't even realize is coming.
So, do you have to say anything about research in nursing practice?
Oh, well, yes. So definitely research is extremely important. We want to make sure as nurses that we are doing research or participating in research. And maybe not everybody will be doing that, but certainly if it's your interest. But even if you're not actively doing research, you personally, we want to make sure that we're looking at the evidence because we want to make sure that we know what the research shows us and making sure that we are practicing to, you know, our fullest potential, looking at that research and following the evidence. And sometimes it can be difficult because I think sometimes, like, we may just do things because it's how it's always been done. And we, again, like thinking of efficiency and time management, like, does that make the most sense? Will that be the best benefit for the patient? Is there another way, and is there a better way to improve their health? And so I think just really considering those kinds of things.
So considering evidence-based practice is the crucial thing. For nurses.
I think so, absolutely.
Okay. What advice would you give to nursing students and early career nurses on maintaining resilience and work-life balance?
Again, take care of yourself first so that then you can help take care of the patient, right? So making sure, you know, kind of like what we would tell our patients, right? Make sure that you're getting sleep. Make sure that you're eating well. You know, drinking lots of fluids and getting exercise. meditating, those kinds of things that we know. We were talking about today with the patients, right?
Yeah.
How to reduce stress, um, and then again, social. We know social is a big aspect for us as humans to help decrease stress and having somebody to talk to. And again, I'll say, and if you're not doing well, mentally, to make sure that you reach out and get
Help.
get
Yeah.
help medically.
Okay. Okay. Are there any opportunities for further education at your university, that is John Hopkins, for the international nurses?
Um, yes, so we have different. So we have our different programs.
Yeah.
So we have master's degrees, we have doctoral degrees, and then we the Johns Hopkins University has different certifications and certificates that people can go to the
Yeah.
website and see what we're offering, and then we're always trying to we're actively trying to grow that space as well. Um, I happen to be the new director of strategic partnerships.
Wow,
And
that's
so
nice.
we are trying to look at like what other things that we can offer um, besides our degrees that maybe people are interested in coming to the school. Various maybe like non-degree
Oh,
things that they could take. So we're actually trying to grow that.
yeah. Okay.
So
I would love
um,
to go there and explore those things as well.
yes, so that would be wonderful.
Yeah, sure. Okay. Having spent almost 40 years in nursing profession, how do you feel about your journey and your experience as a nurse?
I have loved being a nurse. I definitely do not have any regrets.
Yeah.
I feel like I've had a very exciting career that I've had, again, like I said, I would raise my hand, but like opportunities that have continued to come like throughout my career so that I've just really been able to, have a fulfilling career and continuing to learn, keeps it exciting
Right.
as I've gone into new areas or gone into education. Um, I have to keep learning all
Yeah.
over and, again, being in practice and working with students, making sure I'm staying up to date. So it's been really fun and fulfilling career.
That, and nice to hear that.
Yes.
Okay. So, what advice would you give to nursing students like us who are just starting their careers and aspire to make a meaningful impact on healthcare?
I think just take your time, especially those first couple years,
Yeah.
and really think about like where you want to be and really assess yourself, because we all have our strengths, and really
Mhm.
like work on those strengths, and really think about like what is meaningful for you, and what area should you go into so that you can make a difference.
Yeah.
I mean, I think with technology, our world has gotten
That's
smaller,
one way. Yeah.
right? Like we can email and communicate and see what everybody else is doing. And I think just really working like with population health and what we can do for our larger population to just help improve healthcare, no matter, where we live or what our resources are.
Yeah. Okay. I have a question last. So after completing, NCLEX, right?
Yes,
So most of
yes.
us do NCLEX to go to abroad or something like that. So after completing NCLEX, what additional training or courses would you recommend to help us improve our skills and perform better as a nurse in United States? So are there any specific certification or programs that are highly valued for international nurses?
Well, I would say so after your NCLEX,
Yeah.
I would just get some good nursing experience in a hospital. Probably, most likely, would be the best experience in the beginning, um, just so that, maybe medical surgical, maybe the intensive care unit, and just trying to get a couple years of experience as a nurse,
Yeah.
in whatever like field that you're interested in. And then um, if somebody, decides that they want to come to the United States
Yeah.
for a bit, and then you've taken the NCLEX, so then you would just reach out to whatever state you want to move to and see what their requirements to work in that state are.
Oh yeah. So at least experience of, okay, how many years of experience does it requires, or is there any kind of criteria?
No, I don't think there's any like amount of time. I just think to move to another country to apply for a job, I think it would be very smart to um, have good nursing skills, because I think it would be very difficult.
Yeah.
Um, Maybe the hospital would want you to have some experience if you're applying to a hospital, but I think that having nursing experience would be really important. And then, of course, your NCLEX exam. So,
Oh wow. Okay. Now we have come to almost end of our conversation. So is there anything that you would like to add or you'd like to say to us and the future nurses?
yes, well, thank you again for having us here this week. And I just think that you all are doing amazing work. So you should be very proud of yourself. So again, congratulations. You're all
Thank
going
you.
to be amazing nurses. And it's a privilege to have you as nurses and all of us working together. So I think, just continue to work hard, have fun, be flexible, and, like I said, just keep have your social contacts with other
Yeah.
nurses, and um, please reach out to any of us
Yeah, sure.
because I think we can all be helpful to each other. We can
Yeah.
all learn from each other, and I wish all of you well. I know you're going to do great on your NCLEX exam.
Wow. Thank you so much. Thank you for
Yes.
that. So now, before we conclude, so thank you, Professor Dr. Lim, for your valuable time and to make this conversation very meaningful. So I truly appreciate your support and your guidance. So I'm very grateful for the insights that you have provided us. We will surely reach out to you in the near future. So thank you for your time.
Thank
Thank
you.
you so much.
Thank you. Thanks for having me.
Thank you.